السادة أستاذ الأشعة ورئيس قسم الأشعة على دعوتي للقاء المحاضرة دي في الندوة المنظمة في الندوة. كمان أشكر الأستاذة الدكتورة نيرفين سليمان وأعضاء اللجنة المنظمة على تنظيمهم ودعوتي لإلقاء المحاضرة دي باعتباري الأستاذ المؤسسين في المجموعة بتاعت الومن أند أبدومين أند وومن. هنتكلم النهارده على benign versus malignant breast masses. I will talk about just general things, not anything specific. The specific subjects will be completed by my colleagues, by other colleagues. Benign versus malignant breast masses. Anatomy of the breast. The breast is a modified skin gland enveloped in fibrous fascia. It extends from second or third to sixth or seventh intercostal space. It extends laterally to the anterior axillary fold and medially to lateral sternum. It is composed of three major structures: skin, subcutaneous tissue, and the breast tissue, which is the breast parenchyma and the stroma. The breast parenchyma is surrounded by fat and enveloped by deep and superficial facial layer and upper ligament. This is the anatomy of the breast. The breast is very in shape in size. It is a cone-shaped structure with a posterior surface base overlying the pectoralis and the serratus muscles. This is the serratus muscle. And the axillary tail extends from the lateral base of the breast to the axillary fossa. This is the axillary tail of the breast. And it tapers anteriorly from the base to ending into the nipple. It is surrounded by areola. This is the areola and this is the nipple. The parenchyma is divided into 15 or 20 segments or lobes of glandular tissue. Each is drained by lactiferous duct, which converge beneath the nipple. This is an example of the. This is an example of the terminal ducts and the lobules. This is the breast lobule. This is another structure of the. This is the next. شايفة أنا ولا pointer field. This is the areola of the breast. This is the nipple. These are the ducts, and these are the ampulla, and these are the pink ones. They are the breast alveoli, and this is the mammary fat. And this is the breast lobes, and are the lobules of the breast. These are the interlobular connective tissue, and this one is the upper ligament, and here is the subcutaneous fat. Lateral view of the breast profile, it shows the ducts, lobules, the ducts, lobules, and the nipple, and the pectoralis major muscle, and the chest wall and rib cage. This is the chest wall, and this is the pectoralis major muscle. These are the fat, breast fat, and this is the lobules of the breast, and this is the nipple. Enlargement of this is the histological structures of the breast. It shows normal duct cells. This is the basement membrane, and this is the lumen center of the duct. The blood supply of the breast it takes its blood supply from the lateral thoracic artery, which is a branch from the axillary artery. It consists 30% of the blood supply of the breast, and it supplies the upper outer quadrant of the breast. This is the axillary artery, and this is the another thing is the internal mammary artery. It represents 60% of the side. مش واضح الصورة ولا عندي ولا كده. Internal mammary artery 60% supplies the central and medial aspect of the breast. Here is the intercostal arteries. It supplies the remaining part of the breast. The venous drainage, the breast drains through the internal mammary and the intercostal and the axillary veins. Lymphatic drainage of the breast, the axillary nodes drains 75%, internal mammary nodes 25%, culture. Good compression of the breast is essential for narrow equality mammography to spread overlapping breast structure so that true masses can be differentiated from some facial shadows that occur due to soft tissue overlap. Essential mammographic views are cranial-caudal and mediolateral oblique projection. The indications of mammography. Mammography is either for screening mammography or diagnostic mammography. Screening mammography, it is screening for asymptomatic women aged over 40 years. Screening of asymptomatic women aged over 35 years with high risk of developing breast cancer. For example, women who have one or more first-degree relatives diagnosed with premenopausal breast cancer. Women with histological risk factors found in previous surgery, for example, atypical ductal hyperplasia. Investigation of symptomatic women aged over 35 years with a breast lump or other clinical evidence of breast cancer.
دكتورة سلوى أنا آسفة، هو حضرتك لو وقفنا المايك تقدري تعلي صوتك؟
المايك
مش جاي.
انا مش متضايقه منه والله، انا ما بحبوش. لا اعرف ده صوتي جرس يعني. اوكي. Surveillance of سامعين؟ Surveillance of the breast following local excision of breast cancer. Evaluation of a breast lump in women after augmentation mammoplasty. Recent mammographic techniques are digital mammography, tomosynthesis, and contrast enhanced mammography. Breast ultrasound. Just it is a brief talk. Mona will talk in details about the ultrasound. High frequency linear array transducer with center of frequency 7.5 to 10 megahertz is used. The patient is examined in supine oblique position with the arm raised and placed above the head. Scan in radial place. Another thing is ultrasonic elastography. It measures the tissue strain induced by compression to estimate tissue hardness. It can help in differential diagnosis of malignant from breast mass. The indications of breast ultrasound are for women under 28 years with a palpable lump, guided biopsy and aspiration, supplemental screening for dense breasts, axillary nodal staging, distinguishing recurrence from scar. صوت واضح ولا واضح؟ Breast MRI, just it is a brief talk. Dr. Mahmoud Abdul Latif will talk in details about breast MRI, indications of breast MRI, insufficient characterization of breast lesion with mammographic ultrasound and ultrasound examination, occult breast cancer with positive lymph node metastasis, staging of breast cancer and involvement of pectoralis muscles, follow-up after treatment to detect residual or recurrent tumor, possible contralateral breast lesion, breast implant rupture. The technique of examination, I think that Dr. Mahmoud will talk about them in detail. This is a normal mammography, shows the fibroglandular tissue of the breast. This is a normal breast ultrasound. It shows the skin, and this is the subcutaneous fat. Number 3, the glandular tissue, and here we can see the retromammary. This is the retromammary fat, the pectoralis muscle, and this is the ribs. But Pablo, I am talking. Mona will talk about in details. Normal breast MRI. This is an example of normal breast MRI. This is a T1 with the image sequence demonstrating low signal cyst in the left breast. T2 segment with fat saturation demonstrating high signal intensity to cyst in, this is the big one and this is the small one in the left breast. Sagittal T1 with contrast with subtraction MRI in a 55 years old show irregular enhancing mass at the chest wall of the right breast. Characterization and differentiation of breast masses. Breast masses are either benign or malignant. The benign breast masses are either cyst, fibroadenoma, lipoma, duct papilloma, and hamartoma. The malignant breast masses are carcinoma, which is carcinoma in situ, Invasive intraductal carcinoma 75%, intralobular carcinoma 10%, medullary carcinoma, mucinous carcinoma. Other thing is sarcoma, either angiosarcoma or liposarcoma, others metastasis or lymphoma. Characterization of breast mass by mammography. Breast mass, we will talk about the site, which quadrant, upper or lower quadrant, size and the number. The margin, definition of the margin, well defined, speculated or lobulation, either micro or macro lobulation. The density, either of high density or equal density or low density or fat containing density. The shape, either rounded, oval or irregular. Characterization of breast masses by mammography, it is usually associated. There are also associated findings such as calcification. 50% of malignant tumors are discovered by mammography because of the presence of suspicious calcification. And this is the importance of this digital mammography. It can detect well the tiny calcification. Once detected, calcification should be categorized as benign, malignant or suspicious. That is, biopsy is necessary. Skin, nipple and the trabecular changes, abnormal ductal pattern. Here this is differentiate, mammographic differentiation between breast masses. We will talk about benign masses. We'll talk about the shape, margin and the density. Benign breast mass are rounded or oval in shape, well defined, sharply circumscribed, surrounded by halo signs and show macrolobulation. It is of lower density. Malignant breast masses are either irregular, none or partially circumscribed, speculated, microlobulation and of higher density than the normal breast tissue. This is an example of the benign mass, well defined, sharply circumscribed and surrounded by a halo. And this is an example of malignant mass, which is dense, speculated and irregular form. Mammography of breast masses. This is an example of malignant breast mass. Localized compression, magnification view, speculated mass, it is invasive carcinoma. This is a mediolateral oblique mammography in 63 years old female. Dense and distinctly marginated mass. Ultrasound guided core, biopsy showed mucinous carcinoma. This is example of craniocaudal mammography, magnification. It shows a speculated mass and the subtle amorphous calcification. مش عارفة واضحة ولا لا اللي عليها الأرز. Centrally, biopsy showed intraductal carcinoma. Mammography of breast benign masses. Craniocaudal mammography show a well-defined circumscribed mass. Ultrasound showed a simple cyst. Mediolateral oblique mammography show a large, well-defined circumscribed mass with popcorn calcification. Large circumscribed dense mass, chunky, coarse popcorn calcification. Popcorn calcification is usually in favor of benign nature. Calcification within the mass, pathology proof keloid tumor. This is craniocaudal mammography, show a lucent, 3 lucent cysts, multiple rounded or oval circumscribed lucent masses, compatible with oil cyst. Peripheral calcification is seen in some cysts. هنا بين peripheral calcification in some of the cysts. واضحة؟ Mammographic differentiation of benign and malignant breast masses according to the associated finding. The skin is of normal thickness, less than 3 millimeter. The nipple is normal and the surrounding parenchyma is normal in benign breast lesion. While in malignant breast lesions, there are focal thickening of the skin more than 3 millimeter, unilateral recent retraction of the nipple, and the surrounding parenchyma is distorted. These are examples of the skin changes and the nipple changes in malignant masses. Here there is a skin retraction. Here there is marked skin thickening overlying the mass. Here there is a nipple retraction. And here it is a distorted parenchyma called trabeculum. Mammographic differentiation between benign and the malignant masses according to the skin thickening. Here the benign, it It is well defined, sharply circumscribed, and the skin is not thickened. Here there is marked skin thickening overlying the dense speculated mass, which is a malignant mass. Mammographic differentiation according to the architecture. This is an oval, well-defined dense mass. It is slightly denser than the breast parenchyma. This is a speculated malignant mass, which is increased density and shows distorted architecture. Calcification. In benign mass, the size of the calcification is 1 millimeter. The number is more than 5 per cubic centimeter. They are scattered calcification, not clustered. They are rounded, lucent, center, or solid rods. While in malignant, they are less than 1 millimeter. They are numbered. They are 5. They are clustered. They are unroded, pleomorphic, fine linear branching. Example of popcorn calcification, which is seen in benign breast masses. This is a case of fibroadenoma, show popcorn type. Here, this is clustered amorphous calcification, pleomorphic type of calcification. Calcification here, it is an eggshell calcification around the cyst wall. This is an benign, and here malignant calcification, fine linear branching. Ultrasound differentiation of benign versus malignant breast masses. By ultrasound the shape is of benign. خلاص بقى سامعين ولا استعمل المايك؟
صلحوها.
Shape benign are oval or rounded in shape, wider than deeper, parallel to the tissue planes. The margin smooth, thin, echogenic pseudocapsule, macrolobulated. It is homogeneous ecostructure, ecotexture, or variable to hyper echo. Posterior effect is there is posterior enhancement, minimum shadowing, lateral shadowing is present. Doppler ultrasound show normal blood vessel displaced around the breast. While in malignant breast mass, the shape is variable, alignment is deeper than wild, infiltration the tissue around, the margin is irregular, speculated, echogenic halo, and microlobulated. The ecotexture is heterogeneous, markedly hypoechoic, show posterior shadowing with obscured margin, lateral shadowing is absent. By Doppler ultrasound, abnormal irregular blood vessels penetrating the mass. This is an example of benign mass, hamartoma. The shape is rounded, margin is circumscribed, density is containing fat density. This is a carcinoma, which is rounded, speculated, and of high density. This is a fibroadenoma of the breast, rounded, circumscribed, and of high density. The skin changes. This is a carcinoma also, which is irregular, speculated mass with a speculated margin, and it is of high density. This is another case of carcinoma. It shows microlobulated dense mass, microlobulated, and it has an irregular shape. This is a fibroadenoma. It is irregular in shape, but the margin is obscured, and it is nearly of equal density than the surrounding breast parenchyma. Ultrasound. This is an example of fibroadenoma. The length is more than the width, and it is hypoechoic, but not the same hypoechoic as the malignant mass, which is irregular, anechoic or hypoechoic, and it has a posterior shadow. This is a fibroadenoma, and this is malignant breast. Example by ultrasound of benign mass, it is a cyst. This is the malignant mass, intraductal carcinoma. MR differentiation of benign versus malignant breast mass. I think Dr. Mahmoud will talk about it. This is an example of fibroadenoma of malignant breast intraductal carcinoma by MRI. In MRI spectroscopy, there is elevated choline peak in malignancy. This is considered a marker of malignant breast disease. This is a case of typically oil cyst with eggshell calcification. A 40-year-old woman with a small palpable mass, mammography showed eggshell calcification around the cyst. 36-year-old female patient with palpable breast mass. It is a by mammography well defined